Ya'at'eh, and welcome to Four Directions of Wellness. I'm Roberta Diswood. Twobahanishla, Sisakani Bashachin, Nakaidina Dashache Hana Nidashanele. Johns Hopkins Center for Indigenous Health has been a partner with Indian Health Service since 1991. Their mission is to advance Indigenous well-being and health leadership to the highest level. They have offices and staff in Chinle, Fort Defiance, Gallup, Tuba City, and here in Shiprock. To learn more about the valuable work they do in our communities, our guest today is Leonla Nelson. Hi, Leona. Thanks for being here today. Go ahead and tell us about yourself.
Yeah, thanks, Roberta. Thank you so much for having me. Leonla is my name, as you mentioned, and my clans are Ashche and Shle, do Twohana Bashashin, Haskahadzahoy, Dashache, do Kiani, Dashanale, and I am from Tisosmas, Arizona, which is also where I currently reside. I work here in Shiprock at our Shiprock site for Johns Hopkins Center for Indigenous Health, and I also just call it the center. So if I say that through the interview, then that's what I mean. I've been here at the center since 2013 is when I started, and just working through different programming. And currently my role at the site is I am the program coordinator. I also do supervision and I guess technically the community principal investigator for one of our programs, and just overall site support.
All right. Well, thank you for being here. To start, I think it would be helpful to learn about the overall work and program Johns Hopkins has completed and is doing on the Navajo Nation. Then we can focus on a few of them.
Okay. Yeah. Like you said, we've been here for a really long time. Our center first started with vaccine work with infectious disease focus, and then through the years has then branched off to do more behavioral health work and mental health work. So some of the programs that have been done here is vaccines related to like HibVax, which is a vaccine for children. We've also done some pneumonia work, and then Family Spirit is a program we do here, and then just some other programs for teens and young children, and then at other sites some father focused programs.
Okay, and I remember the Family Spirit program was a maternal and child health home visiting intervention. Mm-hmm. What was the purpose of the program, and what did you guys learn from it?
Yeah, so Family Spirit has been around for a really long time. I think we're going up on 25 plus years of Family Spirit when it first started. It actually first started in our Chinle community at our Chinle site, and it's a 68 lesson home visiting lesson program that was very comprehensive. So it focused a lot on not only just taking care of baby, but also moms were asking for help, like about goal setting, finances, going back to school, needing relationship things, support, mental health support. So that program really focused on that, and they had a lot of positive experience from that. And then from that program, that model of the original, which I like to call the original Family Spirit, has then branched off to other Family Spirit programs, which are more laser focused on different things that the community has been asking of us.
Okay. And so from what you have learned, and a lot of the programs have started from Family Spirit, like you just said, mm-hmm. Can you tell us about Nurture and now Strengths?
Yeah, so Nurture we did here in Shiprock in 2017, I think is when we started. And it was really because of childhood obesity, the epidemic of childhood obesity. So Family Spirit Nurture was a 6-lesson curriculum, which was laser focused on reducing the introduction of sugar sweetened beverage to children, and really focusing on positive feeding practices, breastfeeding if mom wanted to do that, and water consumption, just nutrition aspect. And we have since wrapped on that program, and then we had very positive findings. The moms who were in that program who got the intervention showed positive results for decreased sugar sweetened beverage consumption, and then the children also had less beverage consumption and delayed introduction. Positive finding for that was that the children were also growing at a healthier weight compared to those in the control group.
Oh wow, that's really interesting to know.
Yeah.
And so like the research finding you're talking about, what are some of the current lessons that you are using for families?
Yeah, so that program has since wrapped. One of the things that came out of Nurture was also mental wellness for moms, and so that's where Family Spirit Strengths has come into play. With Family Spirit Strengths, the lessons with the moms are focused on them, and it's really about them on what they want to share, like relaxation techniques, and we also do lessons related to coping skills, thinking in a different way. If they let us know or they disclose that they're struggling or they've had struggles with alcohol or substance misuse, then we do curriculum related to that. And those are the moms that are in the intervention. The moms who get the control are actually doing Nurture because that has been proven to work. So we like to say that all the families in our program are getting something beneficial. So either a proven curriculum of Nurture or the maternal mental health curriculum of Family Spirit Strengths.
So the final program that we wanted to talk about is Horizon Horizons. Can you tell me a little more about it?
Yeah, so Horizon Horizons is a newer program that we have here at the center, and it's actually a program. So at our center, we not only do research, but we also do community programs, which we're not collecting data. And Horizon Horizons is one of those programs. And we are doing it in a response to the high syphilis and STI rates on Navajo Nation. So the Horizon Horizons focus, it's a focus on teens and adolescents, and we're trying to help to improve sexual health and to decrease STI rates and prevent unwanted teen pregnancy.
Okay, and is there a certain time that you guys are doing those events, or doing that program?
Yeah, so right now we are doing this program because it's for teens and school-age kids. Then we are doing it in the summer. We're hoping to implement it in the form of a summer camp, or maybe during spring break, just because, since our main audience is teens, just whenever they're not in school.
Okay. Well, it's good to know. I thank you for sharing all that. So before we end the show, how can people get more information or about how to be a part of your program?
Well, they can call our office, and our number is 505-368-4234, and just let us know what they're interested in, and we can screen them and let them know these are the programs for your age group, or if this is where you live, this is what we have going on. Even if it's not in the Shiprock area, as you mentioned, we have sites across the reservation. They can also go to our website at cih.jhu.edu, which, yeah.
Okay. Well, I want to thank you again for sharing all your information, Leanna. And this has been 4 Directions of Wellness. Hogone.